Welcome, welcome, welcome to the Carnosine Lab each and every Tuesday. Welcome to every viewer tuning in locally, internationally, and globally. We'd love if you are tuning in live to put in the comments where you're tuning in from. And if you're watching the recording, also put in the comments where you're tuning in from, where you're watching the recording from. Tag a friend, share this out. Tonight is going to be an incredible continue the carnosine conversation. So as always, this is not medical device. This is education for educational purposes only. And tonight we have two incredible practitioners. So those of you who are understanding carnosine and would like to peel back the layers a little bit more, tonight is for you. As a practitioner, as a healthcare professional, as somebody who is just trying to better their health, welcome to the Carnosine Conversation. Tonight, we are featuring Dr. Kevin Keys. He has an incredible practice. He's been in clinical practice for over 25 years. We also have Dr. Willie Villarreal. He also has an amazing functional medicine practice, and they've both been implementing carnosine into their practices. So they're witnessing firsthand not only the clinical applications, but how it's bettering their practice. Guys, welcome to the show. Excited to have on here. So excited to really unpack this secret weapon that you've taken to the last few months. So Dr. Willie and Dr. Kevin, welcome to the Carnosine Conversation. I'll let you guys take it away. And what have you seen? Why are you here? And let's unpack the beauty of what this incredible product is doing for us all.
Hi, Jess. Thanks for having us on again tonight. I was blessed to have been shown this, product about a year and a half ago. And I wasn't really an early adopter. I saw the benefits right away, but I kind of had it just focused in on athletes. And it wasn't until a couple of months later that we started kind of just using it with every patient with, peripheral neuropathies and starting to learn more about the science and what it actually does. And, I'm a skeptic when it comes to a lot of these things. Dr. Kevin and I are like, I'm sure he is, we're approached all the time with new products, new machines, the hot new powder or pill or supplement. And, while I'm always open to a lot of these, most of them are flops, right? Most of them are just the shiny new toy. And so when I saw this and kind of really dove into the science, I mean, it's really a no-brainer. And then it's really a no-brainer when you actually see it work and how quickly it works. So it actually like proves itself and it sells itself. And it has been probably the single best thing that I have added to my clinical practice over the last like 10 plus years. So would you agree? Where you sit? Dr. Keys, with that, are you using it pretty much with every single one of your patients as well?
Yeah, absolutely. Thanks for having me. And also, Dr. V, thank you for introducing me to carnosine. And, at first, of course, like you said, shiny things that are out there. But and at first, when you approached me with it, it took a little while because diving into the research and then finding out more about it. And it wasn't until I went to your seminar and then you just dove into, this is a Di-Peptide, why this is so important, basically the methodology and the technology behind delivering this into the body, and that you can actually influence these carnosine levels, and then what the potential benefits were. Then, it was a no-brainer, started to use it, again, just more widely than just for athletes. It really is a no-brainer for the athletic community. But then when you start to see the application, especially in I see so many neuromusculoskeletal related issues. And then even as you've experienced in your practice beyond that, even just in the wellness and longevity aspect of practice, what people are reporting is just phenomenal. So I love that it's ease of use as well.
Yeah, and that's the thing is it doesn't take, you don't have to learn how to use it, you just apply it. The thing about it is both you and I and most patients that you see in coming into a clinical setting, they all have pretty much the same thing. They all have a lot of the same struggles, which is chronic pain, slow recovery, neuropathies, metabolic inflammation because of how bad our diet is and how bad our lifestyle is, muscle fatigue, things like that. So, but the problem is what are our traditional options, right? Our traditional options have always been NSAIDs, opioids, steroids, and then just kind of repeated procedures, doing multiple steroid injections until finally like they need a joint replacement or something. So the thing that I saw right off with Lactigo is it just offers a non-systemic, like kind of supportive option that just fits alongside already with existing care. So it's easy to implement, and it doesn't take a whole lot of you don't have to learn a lot about it. You can dive into the science, but it just super effective for pretty much any condition that I've seen, any kind of itis, any kind of injury post-op. I just, there's a patient that's come in and I've had him start applying. He's about to have a total knee Thursday and total knee replacement. And I have had him start using it before, but for sure after, that's going to help him with rehab, because you and I both know that, the hardest part of a total knee replacement isn't the surgery. The surgery was the easy part. It's the rehab after, because if they don't do proper rehab, they'll end up with kind of long-term, limp, they'll end up with a flexion contracture or something like that. But it really helps as far as them properly implementing PT, and that's what I've seen. So what are you seeing musculoskeletal wise in your clinic now with everybody and the speed?
Yeah, like you said, anything with the itis, right? So carnosine has that ability to have that both sides of slowing the once you have the onset of inflammation, it actually slows that, but then it's on a preventive side where it sort of builds up that cascade so that it just doesn't trigger off. The neurological aspect is just, it's really interesting that I love that you're getting these effects and they understand a bit about it, but they're still willing to do more research on it. So specifically, some of the things that can be really problematic in my practice, when you have an acute radiculopathy where, say somebody has a disc herniation, and I mean, these things are a bear. And you'll talk to people and they say, even taking opioids doesn't really, it just makes you goofy, or if you take a muscle relaxer, it doesn't really do much for the problem. And, we can help them in the office, but then there's time in between their visits, and what can they do? And the best home care that we found right off the bat for an acute disc injury, radiculopathy, people apply this to the extremity that's involved, and it just gives them tremendous relief. Better than, so you can imagine over the years, 27 years in practice, how many things I've been approached with regards to topicals and creams, and hey, try this pain, this and that. And I'm not going to name names because I'm sure you have a whole list of them as well. Yeah. But this has just been a different, like you said, it has been different. There's something, you hear about it, you see the science, and everybody has some science behind their product. But then when you put this to use, the utility of it has just been, again, fantastic. So any of the, tendonitis related issues, any sort of sports injury related issues, it's been awesome, especially in between visits. And neuropathy, which is just crazy. You talked about metabolic involvement and how this has an effect on the advanced glycation end product, and that it also tends to downregulate some of the excitability of nerves, and then also bring about the upregulates the GABA, which is a calming effect on the nervous system. So just super powerful. We're seeing it in a host of issues that I see through my practice. So it's a great fit. It's been a great fit.
Well, the question I always get, and I'm sure you always get, is, okay, cool. If this was so great, how come I've never heard about it? And how come we're just now hearing about it? And it's very easy to answer that question because we've never had the technology.
Yeah.
The thing that makes the Lactigo work is the actual patent that we own, that it's ethoderm. It's a delivery system. So just like with other medication administrations, technology improves, and especially now technology is improving like year to year, month to month. That's the easy answer for anybody that asks that question. Why we've never had that before. So we never had the ability to deliver carnosine and magnesium sulfate directly to the target tissue. And that's the interesting thing, is that, with the great science team that we have with Tim Sharp, the head of R&D, and then, Chad Macias, who's the chief science officer, they have done the clinical studies and the muscle biopsy testing and showing the tissue saturation, with carnosine. So it's not just, put it on and we hope it works, and it's doing something. We actually know at the tissue level what it's doing. And there's also, big, studies with equine, with racehorses, where they've actually been doing the muscle biopsy testing and shown that the carnosine continues to increase as time goes on. So it's just been, like I said, super effective, super targeted support, but with systemic benefits. And that's one thing I'm seeing, is now that people have been using it consistently for 60, 90, plus days, they all just report, well, I just feel better overall. I just feel, I don't know what it is. I can't put, I feel more relaxed. People are putting it just every day. I know, like me personally, even on the days that I don't train, I'm still putting it on an easy to access area, like in the morning, shoulders and back and maybe legs. At night before I go to bed, same thing, shoulders and back. But I mean, like you're talking about, the benefits we continue to see are just amazing. And it doesn't matter the patient, because we're still figuring out applications for it. So it just integrates really well with like metabolic dysfunction, insulin resistance, peripheral neuropathies, joint degeneration and arthritis, muscle soreness, myofascial pain. And then again, the athletes and active adults. 3 guys in my practice that are lifetime runners, run multiple marathons. The recent Houston marathon we had, last month, both of them applied it, and both 2 out of the 3 PR'd their time, like first application, like just one application. So I mean, it just works, period. So
yeah, one of the things when you see patients, they'll start and they'll use it, and then they get a result, and then they drop off of it, and then they come back and they're like, wow, that stuff really worked. Mm-hmm. And so I love that there is that science that, like you said, you can know with confidence that this product is actually delivering carnosine into the tissue, and that's measured, like you said, through blood work. They're looking at it, and they can actually tissue sample, take tissue samples and see that the carnosine level actually comes up. But then what that means, like, what does that mean to you? Well, it depends on what's going on with that patient. For example, if you're the marathon runner, that means faster times, faster recovery, better sleep, you name it. Like you said, better metabolic function. These people with neuropathy, that they're not feeling like they're getting bee stings in their feet all night long, that they're sleeping better. When you sleep better, well, then what does that do for you? When you have less pain and, inflammation's downregulated in the body, like, what does that do for you? So yeah, absolutely. Like you said, there's just a whole host of it. Obviously I see a lot of active population, but we have a lot of those patients that I see that are getting injured trying to be active. How many people do you know in their 40s, 50s, 60s that injure themselves at this point in time?
Yeah, they're trying to get back in shape, trying to do the things that we're asking them to do, as far as in the clinic, as far as like diet and exercise and training, and the peripheral neuropathy piece and the restless legs. I mean, I've had multiple people that we've gotten off of gabapentin or Neurontin or other things that just maybe we're numbing it a little bit, but just super important. Like when are you introducing? I know, like, is there specific times that you're introducing it to the patient? Is it like after exams, like during exams? How are you implementing it with them?
Yeah, great question. Typically, we evaluate a patient initially, and then we do especially when they're in the acute pain phase and they're that relief phase and they're inflamed, and we're actually doing some work on them. We introduce it to them right there, And, it's right off of the bat that we get them a tube and they start applying that as part of their home care. Like you said, super simple, very compliant. Patients can be very compliant with it. It's not hard. And, just accelerates the results that we've always gotten great results. It's just an acceleration of that. So.
Yeah. I mean, I just frame it as support, not replacement. And as long as you just frame it the right way and patients understand, hey, this isn't, this is going to be completely supportive, and then they try it. Well, the thing about it is the reason that our hashtag is just try it is because we could talk till we're blue in the face and telling them all the benefits and the sciences. As soon as they try it and they see the difference, they want to continue to, they want to continue to use it. And like I was telling you earlier before, the show started, is I can't keep it on the shelf because the one patient that I recommended to uses it. Then they come back in the next day and buy it for, buy 3 or 4 more bottles for their dad or their mom, or every single person over 40 or 50 has some type of inflammation, pain,
I can validate that for sure, because the same thing happens, same experience, where patients are ending up buying it for other people because of what they experience themselves. And like you said, for, whether it's mom, dad, uncle, sister, brother, whoever, they want to bring them in and show them, hey, this is something really different. I have the beauty of being able to be hands-on within the practice and actually putting my hands on people. So it's really a no-brainer to introduce it that way. So any practitioners that do any hands-on type of work, that's the beauty of where I'm actually introducing it. I just say, listen, we're going to do some tissue work here, and I'm going to use this gel. I tell them a little bit about what it does, and that this is a real, great part of your recovery. If you'll, use some of this while you're at home, this will help accelerate. Everybody wants, better results faster. And this is a shortcut. So let's use it.
Hey, I want to, as an aside, I want to actually point something out. We have somebody, like I just noticed on the comments. We have somebody very, very, very famous on here from Australia. She is well known in the CrossFit realm. She is a perennial CrossFit Games athlete, Amanda Allen, and she was just posting about her how it helped her elbow. I would have given anything 10 years ago when I was competing and to have had this. And I've said that multiple times because, CrossFit's a great sport, but CrossFit will beat you up and at the competitive level. Okay. When you're competing at a high level, it is not really about, we say training is digging a hole, and, recovery is filling that hole back in. And I had I was blessed to have been part of CrossFit Invictus, or Team Invictus, and for a couple of years when I was competing. And Josh Bridges, who's another just famous, CrossFit well-known guy, great guy. Basically, I remember training with him when I went out to San Diego, and he goes, you want to train, keep training, but if you do not recover, if your house, he said, doesn't look like a science experiment, he goes, you're doing it wrong. He goes, you need to recover. And there was nothing like this for CrossFit competitions, for now high rocks that everybody's doing, triathlons, things like that. From a sports perspective, I mean, it has been amazing for recovery, and it's so few people actually know about it. But I just wanted to point that out because Amanda is somebody that, I remember when I was competing a few years ago, looked up to. She had gone multiple times, and it was an amazing CrossFit Masters athlete. So she's using it. I feel every Masters CrossFit athlete should be using it, or anybody lifting over 40 or 50 should be using it. But like I said, no brainer from a training perspective, but super excited almost every day in clinic. And just the stories that keep coming back, the stories of half the time it's in disbelief, right? So half the time it's in, I don't know if, I didn't believe you that it would work as quick as you said it did, but it sure did. And again, just try it. So,
Well, I think like we all know, like creatine, you talk to any athlete that's out there and they're all using creatine, right? And so I think that this is one of those things that at some point in time will be like the new creatine. And I think that actually the results of recovery and everything, you know, I've put that to the test myself, actually, you know, took the creatine down and just tried to see with Lactigo how you recover and how well you recover, and recovery is great with it.
Yeah.
The question I had for you, Doc, was since this is a dipeptide, and peptides are such a hot topic and everything out there, you know, there's a lot of the BCP 157, TB 500 people that are using that. What's your thoughts on sort of this versus that? And I could tell you just from, you know, my side that this has just such a more wide-ranging effect than that, and you know, cost and administration of it and those types of things. But I'm just curious to see, you know, what your thoughts on it are.
So I've used and recommended BPC 157 and TB 500, ideally mixed, for many years. I've not seen the recovery. Now where it has its uses, you got to still remember it's not going to be available to the public, really, to the majority of people. Why? Because it's an injection. Most people are needle phobic. As small as, you know, it's a little sub-Q injection. You're giving yourself an injection 1 or 2 times a day. You know, some people do it systemic, some people do it in the area of injury, but you're giving yourself an injection, and that kind of limits, you know, the application of it. But from, when you look at the mechanism is way different. You know, BPC works by, you know, reducing inflammation locally and, you know, honestly causing angiogenesis or blood flow to that area, which just helps with healing. Whereas, you know, the carnosine is like, it's a different type of peptide. Peptide is just a general term that's just a protein. It's a mix of different proteins. Different peptides have different sequence amino acids, like BPC is a 15 sequence amino acid. Well, this is just a dipeptide, so it's just 2 amino acids. It's the histidine and the beta alanine. But the beauty of it is there's no contraindications with this. You know, BPC or any of those, you always want to make sure somebody doesn't have cancer or somebody, because, you know, you don't want to cause angiogenesis. So there are contraindications. There are medical interactions that can happen that you need to be aware of. It's generally safe, but there are interactions with the carnosine. There are none. So there is no contraindications. There's no medical interactions. I don't have to worry if it's going to interfere with the medication. And there's no upper limit. So that's the other thing, is you can't put it on too much. You can put it on multiple times a day. And the sweet spot is really a 3 plus.
I think cost is a big factor as well.
Yeah.
It's just cost and accessibility, and like you said, no prescription required at this time.
And I will say this, for all the hype on BPC 157, does it work? Well, yeah. But I've not seen it work as well as this. The majority of people, like, I have not seen carnosine not work on somebody. There has not been somebody that has come back that has used it yet and said, no, didn't feel a thing. Whereas with BPC, I mean, you do have patients that, you know, will use it and didn't feel anything. You know, it didn't help their injury. Now, again, are they using it properly? Is it for the right application? I mean, it's not going to heal a rotator cuff tear, but, you know, if there's inflammation, then maybe. But again, going back to Lactigo, I have yet to see a patient come back and say that it didn't work, period. So different class, also different peptide, you know, different applications, but this is easy where anybody can use it, anybody can apply it, anybody can put it on topically. They don't have to be shown how to inject. They don't have to, it's not an injection, it's not invasive. That's the biggest thing, it's not invasive. So, you know, it wouldn't prevent somebody from using it. You know, the only thing that could prevent is not being able to reach a spot on your back. And I saw a cool tool in Utah that some of the guys up in Canada, in Utah and Canada have, and it's like an extension applicator where you can put the Lactigo on there. So I'm not sure where they are, selling it or promoting, or if they just have it with their team, but they had boxes. I mean, look, it was pretty cool, but that's the only limitation, is not being able to reach where you apply it.
It's funny the things you hear, and that is one of them, where people put a big glop of it on and then it goes flying off with their hand because they're trying to get behind their back. It might have happened to me once or twice as well, but
the only negative side effect that I can see with Lactigo is accidentally putting the menthol or not washing out the menthol and touching your face, which I've done a couple of times.
Or other places,
that kind of spreads too. But other than that, the menthol, again, it's here. People love the menthol, or they like the regular. Either way.
Well, that's one of the things that I've tried to use the non-menthol specifically because I've tried to delineate, because there's so many of those types of topical products that are out there that I don't want people to think it's just this menthol, that it's in my head, or this is just another, XYZ, and what they are. I'm not going to say their names of the products because I don't want to beat them up about it, but this will absolutely stands apart. It's like, well, this doesn't even smell like anything. It doesn't even whatever. And then, so just, give it 5-10 minutes. And they're like, wow, But what's interesting, and you do have to tell people, is that, you can use it for multiple use. So typically when somebody's coming in for one specific issue, then, they come back and then they tell me about some other part of their body. And I said, well, did you try the Lactigo on it? No, well, I was just using it for that. And I was like,
yep. Or they use it only for activity. Like I thought I was only supposed to use it during workout. And I'm like, no, you need to use it. It has basically many different uses, and you can't put it on too much. So, and then when they start using it the right way. So the biggest thing for me is education. And not just with Lactigo, but just in general with practice. If they're more educated about why they're doing a therapy, they're more likely to do it and keep up with it. So with the Lactigo, I briefly explain some of them that are higher level patients, that want to know. I'll go into what carnosine is and what the magnesium sulfate is and what it does, and I just kind of simplify and tell them, hey, it's just like Epsom salt baths, and magnesium sulfate absorbs, it relaxes you. Some of my other patients want to know more. Then I have handouts, that we have printed up that we give to them. I have little cards that, we give to them that has, our QR code and how to apply it, the frequency and how to use it. Simplest directions are minimum AM, PM, before and after activity. With an acute injury, if it's something acute, like it's hurting right now, I tell them 3 times a day is a sweet spot. Other than that, like, I just stress to them, you can't use it too much. You can't use it too much. So.
We typically, because we're seeing patients with active pain-related problems, active inflammation going on, we do 3 times a day. And then, you can get them down to that twice a day point. And then I think the education, like you said, it really is important that this isn't just a pain gel. It's not another pain gel.
Yes,
this is carnosine, and it has much more lasting effects on the body and health and longevity. And the carnosine lab, the carnosine lab is a great resource. And I do drive my patients to say, like, look, it's all at your fingertips. I can give you this little flyer, and and we do have some handouts and material like that, but those will get left in cars or wherever they leave them, and they lose them. But going to the carnosine lab, they can and they actually go on there, and then they learn, well, you didn't tell me about this. And I said, I'm glad.
It's a lot to understand. I forward them to that. So people that are on the site, it's thecarnosinelab.com. And so that's, I will write it for them, or I put it on the card, and I forward them to that as well. The aesthetics.
Well, Dr. Giselle, just like you mentioned that about the whole effect on aesthetics, right? And Dr. Giselle has a big part of her practice and she talked a lot about that. So it has so many wide-ranging effects. It's an amazing tool.
Yeah, and we can have, you know, more in depth if some of the viewers want to send in their specific questions. You know, we can have a deeper dive into the science. This is just more surface level, what we're seeing in practice, what we're doing with practice. So, you know, what specific issues we're using for, and really there aren't any specific. They're broad. So, you know, again, we always tell people we don't use it. This isn't using to treat anything. You can't really like claim that. You can't make any claims, but what I can tell you is that every single patient that we've used it on for whatever application, it's worked. I haven't had anybody. I'll tell people all the time, if it doesn't work, bring it back. I'll use it, but I haven't had a single patient bring back any product or say it didn't work. So that's the biggest testimonial to me.
Yeah, well, you support the body in the right methods and the physiological processes, and the body knows what to do. So you're not, we're not treating a specific disease conditions specific, but the mechanisms of a lot of those chronic diseases and the mechanisms of a lot. We're coming down to that layer of providing the body support in those specific layers where the body's able to, heal itself. It's amazing.
Yeah. Well, yeah. So, I mean, everybody needs to be using it, and everybody needs to be honestly sharing it, because there isn't a single person that from teenage baseball academy kids to volleyball club girls to cross country to elderly. I mean, every single person can benefit from it. And even 20, 30-year-olds that are hard chargers that are very active, they're seeing a benefit from it. At some point in life, everybody's going to have an injury or an inflammatory issue, and this has been the single best tool. So super excited to be using it in practice, and there isn't a single person that comes in that doesn't hear about it or at least get exposed to it.
Amazing. Thank you guys for unpacking. And literally, as we're hearing you guys talk, it's like boxes just keep getting checked. Like, no adverse side effects. Can't use it too much. Every age can use it. I mean, this is just mind-blowing. And I love this carnosine conversation. And as we see these comments coming through, we're listening to each and every one of you guys. And this is why the conversation keeps rolling, because there's so much to unpack. And before I let you guys go, I want to know, because you guys have been in practice decades, and this product has been out for decades. So what are you most excited about for the future of carnosine, not just for your practice, but for what you know and what you're seeing?
I'll let Kevin go.
Yeah, well, I think that Dr. V brought up a great point. In his conversation there was talking about like these younger athletes, and we know that carnosine levels in kids typically are higher, and then it tapers off as they get into that age frame. But I've noticed, like, in the last 20 years, how many kids that I end up, or young athletes that I see, just because of the intensity now. Like, you go back 25 years and with the intensity that these kids trained at. So I really have a family practice, and I do see a lot of athletes, and a lot of the that age group in the high school athlete is it's a huge thing. And again, parents don't want to give their kid a drug, which I don't blame them. Again, you don't want to be injecting these young kids. So portable. And then, like, because it is a family practice, just these elderly people that, come in with, things like neuropathy and these other, that when you have restless legs and neuropathy is just it's just so horrible. And things like TMJ, where people really don't get much results with something like that. And you can have pain relief in your purse with something like that. I mean, it's just, I'm excited to see. I think that it's going to be just so commonplace. Everybody's going to jump on this. So I'm really just thankful to be on the front end of it, to be part of this, to help spread that word, and to let people, and especially for my community, to be able to get that into their hands and to see the results that they're seeing. So.
Well, we're so grateful you just tried it, Dr. Kevin, and
Yeah.
you took it by the reins and are blessing other people's lives with this product. You know, I love that you said every age can use it too. In our household, we have 1 all the way up to 80, and we have it next to our toothbrushes. It's like our topical multivitamin, right?
Yeah.
Use it every day, use it throughout the day. And so, Dr. Willie, I'd love to hear what you're most excited about, and then we'll wrap up.
Just the speed at what this company is doing, getting the word out. Just like these lives, the last conference that we had. Looking forward to another conference in the summer, and just seeing it grow and grow and grow into something huge. Because again, like I've never seen a product yet. There are a lot of them that are special in their own space, and they just become they just blow up and become huge. I see this as a product that's just going to become huge because it has so many different applications, the ease of use. But this company is actually going to, most likely going to be in every single, eventually practice, every single household. I mean, it should be just because of all the different applications. But from a medical and athletic standpoint, like, I mean, every practitioner, trainer, physical therapist, chiropractor, I mean, they should be using it because of how well it works, period. So I'm just excited about the new products coming out in the future. There's some really, really cool things coming, down the line too. So that's also what I'm excited about. Oh, did she freeze? There she is.
Thank you.
I thought you were just frozen. I thought you were just in awe.
I am in awe. I am shocked and in awe. And we have a snowstorm blowing in here. So sorry about that interruption. But those of you tuning in, make sure you like us on Facebook, like us on YouTube, the Carnosine Lab. There may be some questions we have already unpacked in previous conversations. For the women out there, we've covered a lot of the aesthetics. For athletes, we've covered some of those. And the conversation keeps continuing. So as you're watching these, type in the comments. We are listening to you, and we are going to keep unpacking the science of lactigo and carnosine. You guys, thank you for being on tonight. I love this carnosine conversation. And, the more we see, the more we are understanding, and you guys are part of the journey with us. So thank you, Dr. Willie. Thank you, Dr. Kevin, for being on with us tonight. You guys stay tuned, and we'll see you next week. Bye for now.